Kids Care Everywhere has touched the lives of over 3 million children in Vietnam, and even more worldwide, in other developing countries around Asia and Africa. Vietnam is a unique blend of two contrasting worlds, where ancient traditions meet modern innovations. And nowhere is this better illustrated than in the healthcare arena.
As our Kids Care Everywhere teams have traveled throughout the country of Vietnam, we have found that the hospitals do have good computers and they do have reasonably reliable internet access in both the rural and the urban provinces.
In contrast with the modern technology and the rapidly growing young, educated population of Vietnam, the healthcare systems and hospital infrastructures are outdated. Medical training is frequently inadequate, and hospital resources are dangerously overwhelmed.
In medical school, classes are taught in Vietnamese, while many of their textbooks and journals are in English. This makes medical English proficiency highly variable there.
After graduating from medical school, most physicians practice in public hospitals, where they treat a vast number of sick children without much help from the available medical references.
Over and over again, we have heard the pediatricians in the hospitals say that the medical providers and the facilities have great difficulties handling the huge volume of patients that they see. For example, 5,000 to 6,000 children are treated every day in Ho Chi Minh City Hospital Number 1, and one pediatrician may see up to 150 patients in 4 hours. That's one patient every 96 seconds. This sheer volume of patients exceeds almost every major pediatric hospital in the world. It is especially overwhelming during peak winter seasons and during dengue epidemics when up to 8 patients may share a single bed.
So what is the role of Kids Care Everywhere in Vietnam? Kids Care Everywhere bridges the gap.
Since 2006, Kids Care Everywhere has returned every year to Vietnam to donate PEMSoft, a decision support software tool. PEMSoft is a vast medical database used in hundreds of hospitals in the United States and worldwide as an advanced pediatric care reference and guide for physicians.
PEMSoft replaces outdated libraries and old textbooks with a comprehensive electronic reference, putting a digital library into the hands of practicing physicians. We train these physicians through a full-day Kids Care Everywhere conference, during which we donate and install software onto everyone's laptops, granting them free, unlimited access to a customized version of PEMSoft. This version includes the internationally reviewed modules and references used here in the US, as well as Vietnamese textbooks.
With every conference in sight, we evaluate the software and our training to find out whether physicians can 1. Understand the software's English-based recommendations, 2. If they can navigate the program to answer clinical questions, and 3. If they can incorporate PEMSoft into their real-time medical practice.
In 2010, we led major conferences in Hanoi's National Hospital of Pediatrics, the Provincial Thai Binh Hospital, the Huế College of Medicine and Pharmacy, Ho Chi Minh City Hospital Number 1, and Ben Tre Hospital in the Mekong Delta. In just 5 days, we trained over 200 pediatricians from both urban and rural provinces. Collectively, these hospitals care for over 3 million children every year.
In 2010, Kids Care Everywhere really took 3 giant steps in Vietnam thanks to the generous support of our growing donor community. First, we increased the number of hospital sites, increased the number of physicians trained, and expanded to the rural provinces. Second, we developed a rigorous evaluation and research program. This provides a comprehensive inside view of the healthcare system in Vietnam and how PEMSoft works on the ground, and allows us to objectively evaluate our program's effectiveness. Third, we implemented a 6-month internship program. Our two super interns are working hand in hand with our Vietnamese partners to train more physicians, to install more software, and to gather better epidemiological and efficacy data.
Through ongoing feedback, KidsCare Everywhere constantly evaluates and improves our services. And as healthcare and technologies continue to develop in Vietnam, so do our approaches.
Through our own evaluation and research, and through continued collaboration with our Vietnamese partners, we have identified our next 3 steps. 1. We are refining our technology by testing whether online access and handheld apps can be used to reach physicians in their bedside care settings. 2. We are further customizing the software for Vietnam by providing Vietnamese language translations of the most widely used topics and by incorporating current, reliable epidemiological data about local illness and injury patterns. And finally, 3, we are enhancing our training by integrating a stronger clinical component in the software demonstrations. These steps are critical to promoting our mission to help care for kids everywhere, both in Vietnam and all around the globe. Based on this successful model in Vietnam, we will be extending our reach to include new core sites in other countries in Asia and also in Africa, where we already have early outreach programs.
Follow our progress at www.kidscareeverywhere.org and support our global mission.